Thank you, Chairman. Welcome, Dr. Adams.
Good to see you again.
Good to see you again. First of all, thank you for mentioning CVS in your testimony. CVS is headquartered in Woonsocket, Rhode Island. We're very proud of that company, and we're particularly proud of that company's decision to take cigarettes out of its store, all of its stores, and indeed they quit the United States Chamber of Commerce when it was discovered that the United States Chamber of Commerce was attacking tobacco regulations around the world. So they have really dialed in on the health concerns about tobacco, and I think your recognition of that is a very nice thing for them and for Rhode Island, so I appreciate that.
And even though they took an initial hit, they actually are more profitable because they made a healthy decision. I think that's important for folks to understand. This wasn't just something that benefited the health of folks, and it wasn't just a philanthropic endeavor. It was something that actually made economic sense for them to do in the long run, and that's what we want folks to understand and why the CVS story is so powerful.
Yeah. You also mentioned the discrepancy between the amount we pay for health care in this country and the outcomes that we get. You mentioned life expectancy, but there are plenty of metrics. I always have in my mind the graph of the OECD countries that shows the chart of them measured by life expectancy and by per capita cost. And America is like way out here, highest per capita cost by a ton over all of our competitors. And yet, for all that extra money, we're not getting gains. We're below the midpoint of the pack, as I recall, lined up with Croatia and Greece for life expectancy. So what's interesting to me about that is that it suggests that there's real opportunity for good bipartisan work to be done here in this committee to try to cure that problem. And instead, we seem to be in this relentless Groundhog Day horror fight trying to undo health care for Americans and, you know, to hell with the collateral damage in individual Americans' lives. And it's frustrating because I think we could be much more productive than this was endless repeal and replace zombie that keeps coming out of the grave to no good that anybody can identify other than the political good, I guess, of putting the Affordable Care Act up as a sort of political trophy for the big Republican donors. The whole thing is very frustrating. But I want to focus on one particular area because you spoke with a lot of passion about this when you and I met in my office, and that is the area when people are getting to the end of their life, when they have very advanced illnesses. And as you know, there's a group called CTAC, the Coalition to Transform Advanced Care, that is engaged with a lot of the business community, big business community leaders, to try to provide a better way of managing that, that time. And in Rhode Island, we've done a lot of work that I told you about to try to take better care of people who are in that period of their lives. Very often what we see tragically is that somebody who wants to be treated a certain way doesn't get that choice honored, partly because we haven't actually documented what their choice should be well enough, and partly because the healthcare machinery just grabs them and grinds them along, and by the time you've been able to intervene, it's too late, and they've had procedures they didn't want, and they've been in the ICU when they didn't want to be, and they weren't at home where they did want to be, and all of those things have gone wrong. In many respects, I think the way we pay drives the care we get, and I encourage you to continue looking at ways that you can be an advocate for people suffering advanced illness in their last months of life, who I think are very often casualties of our healthcare system because their voices simply aren't heard. And I'd renew my invitation to you to come up to Rhode Island and let me show you around what we're doing. You said you were interested in doing that when we met,
yes.
And I'd renew the invitation today. So if you could respond for that, to that point.
Absolutely, sir. I'm looking forward to coming up there. I've been in touch with your health commissioner constantly. By focusing on end-of-life care, we will be able to save tremendous dollars in terms of health care costs. But I'm going to show you an amazing display of message discipline. I'm going to show you how that fits into wellness. Folks who are healthier, who live a lifestyle of wellness are going to not only live longer, but they're going to live healthier, they're going to have less healthcare costs. You're not going to spend that much money on end-of-life care. But as you mentioned, just as importantly, part of wellness is having a plan for how you want to die. It's going in and talking to your primary care physician about what you want and making sure it's documented in a way that folks understand and that can be communicated when the time actually comes. And so even this, when you move upstream, comes back to focusing on wellness and making sure we're concentrating on that as a community instead of waiting until someone gets that terminal illness and then trying to sort it all out on the back end financially and philosophically.
Thank you, Senator Whitehouse.